Introduction to Esophageal Motility Disorders and Cancer. So let us understand the structure of the esophagus. Okay, so we have the cervical part of the esophagus here, the thoracic part of the esophagus, and the abdominal part of esophagus below the diaphragm. Now, regarding the functional, the muscular component, there is an inner circular muscle and an outer longitudinal layer. The esophagus this is a mucosa. The esophagus is devoid of serosa. There is only adventitia around it. There is no properly formed serosa in the esophagus. There is an inner circular and an outer longitudinal muscle layers. Now, what is the relation between esophagus and age? What are the different problems affecting the esophagus in different age groups? So, in the young age group, it will be esophageal atracia and the tracheoesophageal fistula. The esophagus, this is a pure esophageal atracia where there is no connection between the esophageal ends. So, this is esophageal atracia generally affects the newborn period. We can see the coiling of the Ryle's tube in case of esophageal atracia. The Ryle's tube is not going beyond this point. Then as the child advances in age, there is a high chance for the child to drink the corrosive substances in the room, in the home and the kitchen. So corrosive strictures, when the child intake a corrosive substance, there will be inflammation and there will be strictures in the esophagus. So the corrosive strictures in the esophagus happens in the toddler age group or in the early school going age group. So this is a classical corrosive stricture shown in the esophagus. Then in the young age group, younger age group, when there is anxiety, when there is psychosomatic disorders, that age group there will be esophageal motility disorders. The structure of the esophagus will be normal, but the peristalsis in the esophagus will be affected. So that is the esophageal motility disorders. In older age group, there will be esophageal cancer. So in an adult, as far as a general surgical unit is concerned, when we find a patient with a dysphagia or clinical presentation, we have to suspect about an esophageal motility disorder or an esophageal cancer. Towards younger age group, we have to suspect esophageal motility disorders. Towards older age group, we have to suspect esophageal cancer. And our methods of investigations for esophagus are basically barium and endoscopy. In endoscopy, if we can see a definite lesion, it will be an esophageal cancer or a tumor. Or if there is endoscopy is normal, we have to suspect a esophageal motility disorders. So that is regarding the introduction to esophageal motility disorders and esophageal cancer.